our very special guest this morning. We have Raquel Giorgio with us, and she is one of whom we call our New Six Chicks gang. I think you came up with that, Raquel. Oh, and we also have Dr. Rostorfer, who is her doctor, and we're basically just really wanting to build awareness. Dr. Rostorfer, thank you for being here also this morning.
My pleasure.
And Raquel, I want to start with you and this journey that you have been through because, you and I, you were here when I first got here 14 years ago, and your background is in news, and you know that we have good stories to tell and bad stories to tell, but you're a positive person in general. So what has this journey been like for you to go through a cancer diagnosis and all these treatments? Because I feel like you've been so positive.
Oh, thank you. I try to be. I can't lie. It wasn't always a fun time. When me thought of the diagnosis, I don't want to die. I don't want to get sick. I want to sit out on life. That was a big one, like sitting out and getting treatment. I don't want to do chemo. I don't want to lose my hair. All those things. It's scary. And when I was diagnosed, I had a full year. I'm still at the tail end of it. To deal with all of this treatment.
And you decided really early on, you pinned it hashtag oodles of optimism. And that was,
yes.
that was, there you are right there ringing the bell. When did that happen?
That was right after chemo. So I had gone through 12 weeks of chemo once a week on Thursdays. It was not fun, I'm not gonna lie, but I had the most amazing support system, the most amazing friends. I had a different person taking me every week, and we had a blast actually in our little room laughing and going through the treatment, even though it wasn't fun and it didn't feel good.
And I know, we're curly girls. I know you love your hair just as much as I do mine. And you were able to save your hair through this treatment. And, I see it's still just as thick and beautiful as it's always been. How did you manage that?
I was blessed, and I'm not going to lie, I thought that every day I would wake up and there would be no hair, but Dr. Rostorfer, who is my oncologist, fabulous guy, he introduced me to the Paxman cooling system, which was a new machine that they had just recently acquired there at the hospital, and it required a lot of work on your part to prepare for it. You had to, wet your hair. My husband, Paul, went with me every single time to get me ready for it. You had to kind of put the cap on, sit there for a longer period of time before the chemo so that your head froze. Literally, your head would freeze and you'd be freezing. I had like 4 blankets
like a brain
on me.
Freeze?
Yes, pretty much. And you had this on, and then you got the chemo, and then you had to stay there and keep the hat on and stay frozen, basically as an ice cube, until it was all over. But let me tell you, it was worth it. I was very blessed to have that option. Not every office does, but Orlando Health does. And yes, I am so grateful. I lost maybe a few strands, but it was good. I was just one of the lucky ones. And yeah.
So now you said you have 2 treatments left. So do you do this device on those next 2 treatments? Like how many more times would you need to use that, or are you done?
I am done with that. I actually only used it during the chemotherapy stage.
Okay.
So that was 12 weeks. I'm also getting a drug that I've been getting for the past year, which is every 3 weeks as an infusion. And I only have 2 more left, and I'm very excited.
I'm so excited for you too, and I'm just so thankful that you're healthy and you're able to tell this story for us. And Dr. R, you call him Dr. R, he's here too and can give us a little bit more of the science behind how all this works and a little bit more about, Raquel's cancer. Good morning, doctor. I want to ask you, most importantly, this cool cap is giving people a lot of hope, especially, the ladies. We're worried about how the treatment will make us look, and then that's affecting how we feel. So this is giving a lot of hope.
Yes, it's been fantastic. We started piloting this program about a year ago now. We had one machine, and we wanted to see was there demand for it, and how is it going to work, and just working out logistics of using it. And it's been an overwhelming success. People have loved it pretty well from day one, and the demand is very high, and we've actually opened this up to all of our other locations as well. So I think all of our other locations have at least one machine, and we're talking about how to expand it further.
That's awesome. And can you tell us a little more about the particular, cancer case that Raquel, went through?
Mhm.
Because we talked about the HER2 positive, and there's so many things
Yes.
when you take into this, but like Rock didn't have the BRCA gene. So some people have the BRCA gene that plays into it, but
Yes.
like she had no history of this and you caught it early, right? So can you tell us more about her case and just what went into that?
Yeah, so we talk all the time about routine screening to detect early breast cancers, and the importance of that we just cannot overstate. Um, if we see somebody who has a palpable mass, they or one of their doctors or somebody detects it on an examination, it's much more likely to be a larger cancer or more advanced by the time we get to it. So, you know, as annoying as mammograms can be to do every year or so, the early times that we find these cancers, most of the time we find them before they are even noticeable, like before they can be felt. And that makes it much less likely that somebody's going to have a bad outcome whenever they have the cancer. So for Raquel's cancer in particular, there were a lot of features about it that were extremely common. We test cancers for three major markers that can impact how we treat them: estrogen receptor, progesterone receptor, and HER2. Hers was ERPR positive, estrogen and progesterone receptor positive, and HER2 was also positive, which makes this a little bit less common cancer. HER2 positive cancers are about 15 to 20% of cases, but they do have a higher likelihood of recurrence, which is why we end up treating a lot more of these types of cancers with chemotherapy and antibodies, like what Raquel had.
And I would like to venture to say that her positivity also plays a role in treating
Yes.
patients, that that positive outlook. So what can you say to speak to that?
Oh boy, there is no question about it. Um, when somebody goes into this overwhelming, terrible diagnosis, and they know that they're going to do well, they do. If somebody goes into it looking at every negative aspect of it and kind of complains the whole way through, they're going to have all of the side effects possible because they're looking for them.
Mm-hmm.
So having a good outlook is crucially important. Having good support, people who kind of share your sentiments and kind of help people through, it's crucial.
Mm-hmm.
People tend to do so much better that way.
Yeah, and Raquel, like I mentioned before, you've been a longtime journalist, storyteller, assignment manager. You know a story when you see one, when you hear one. Your husband's an award-winning photojournalist, Paul, here with us every day. And so when you look at your story, what do you take away with you, now that we're talking about it and helping share it with everyone?
Well, two things I want to make a point of. The first is push for an ultrasound. Not all women get an ultrasound with their mammogram, and if you have dense breast tissue, like I did or do, you need to get an ultrasound. The mammogram was clear, and so if I hadn't had an ultrasound, this would be a totally different story. We would have caught this a year later, and I might not be here. I wouldn't be here talking to you right now. So the early detection is absolutely key. It makes the whole journey a lot easier. No, it wasn't fun. I had surgery. I had chemo for 12 weeks. I had radiation for a month. I had this Herceptin that I'm getting every 3 weeks, which is an exactly fun either. But in the end, look at I'm here. I'm here. So push for the ultrasound in addition to the mammogram. It can detect things that the mammogram does not. And don't be scared. It's scary, but it could be a lot scarier. And it's better to know. The other thing I want to say is for those of you who, I know there's a lot of women that are recently getting diagnosed. And for those of you who are just getting diagnosed, please have hope, especially if you catch it early. It's not going to be a fun year. It might be a terrible year, but there are so many beautiful moments in that year. You realize how loved you are. I had no idea how many people loved me. It brings tears to my eyes because, I mean, hundreds of people came to support me in different ways, and that was a gift. I mean, that was the gift of the year. And now I got to say, every day feels like a birthday to me because every day you realize you can't control what's going to happen tomorrow. And I know everybody says this all the time, and it's a cliche, but it's true. Once you go through the breast cancer battle, you really need to enjoy these moments of joy every day and just take each day as it comes and just be so grateful for all the love you have in your life. I just had no idea. And I am so grateful to so many people out there that helped me through this journey.
And you talked about worry. You know, even though you're a positive person, you said that you struggled with worry, but it's not like that anymore. How did you overcome that?
Well, I'm not going to say that every day is like that, but I have to remind myself and looking back at like even Facebook memories, looking back and seeing where I was a year ago today. Like a year ago today, I was prepping for surgery. I thought the world was coming to an end. I was worried I was going to die. I was worried about a lot of things. And now I look back and I'm like, I don't have to worry about all those things. I get to enjoy my job today. I get to enjoy life today. I work at Disney, as you can see, and they have been fabulous through this whole journey with me. And yeah, I just get to live and enjoy people in my life and take each moment as it comes and loving it all.
Yeah, I know that, Paul and your daughter Ainsley just so overjoyed to just be through this journey with you, and I know that you were thinking about all the things that you want to still experience with her as a mom. I know you're a proud mom, so it makes you cherish it that much more.
Exactly. And so I coined the phrase oodles of optimism.
Yep.
And I feel like that can carry me through the rest of my life, however long it is, because, if you just look for the bright side, even when things are really, really dark, all the people that love you, all the great care you can get from Orlando Health, from your employer and all of that, it just helps you get through the journey and see the bright side at the end of the tunnel.
And this technology you were able to use, I always talk about how Central Florida is so full of resources and technology, and we're just really fortunate and blessed to be in an area where you have access to a lot of the newest things that are, making it a little bit easier.
Right. For people who live in rural areas that have to drive hours to get to a major hospital like Orlando Health, they may not be able to do this. And I am blessed that I'm in Orlando and that we do have such great technology and such great hospitals like we do.
So if people want more information, Raquel, Dr. R, where should they go? Because we think about, like she said, access to care, cost is sometimes very intimidating. So what are some resources we'd like to close out with today?
Well, specifically Orlando Health, that's one, orlandohealth.com. We have lots of different resources and stuff on our web pages for access to different types of care if care is needed, if there are particular questions about if we have something like Paxman, it would probably come from the treating physicians mainly, because I don't know that we are advertising that on our website, at least not yet. If there is information needed regarding Paxman, then Paxman, I think Paxman.com is their main webpage where they would have a lot more resources too.
And Raquel?
I just think I mean, resources, go to Dr. R. He's
Yep.
great. Orlando Health, Dr. R.
Yeah, come to
There's
me.
lots of stuff on. Yeah, come to him. He'll be very busy. There's lots of resources online, but yes, go to the best doctors that you can find. And I think I did.
Yes, you did. I'm so happy to hear this good news this morning, and thank you for sharing the story, Raquel. And Dr. R, thank you for joining us. And like she said, early detection is key. You don't have to wait for a certain age either. Talk to your doctor, get the mammogram, and get the ultrasound, right, Raquel? And you said that, this is something that you need to ask for because maybe it might not be just offered right away, even though it probably should be both exams.
Correct.
And self-exams.
And the self-exams, you're right.
Yes. Find out early so that you can continue to live life the way you want to live it.
Awesome, awesome. Thank you so much for being here with us this morning, and we'll have this online later too to review, and hope to see you soon.
Sounds
Okay.
great. Thank you, Bridgett, for having me.
Thanks, Raquel. See you soon. Bye, Dr. R. Thank
Bye,
you.
Have a
Dr.
great
R.
day.